We're Group 12, and for our final presentation, we're looking at the epidemiologic transition and how we can go about reducing the global health burden of non-communicable diseases. Starting off, the epidemiologic transition refers to demographic changes that occur within a country, specifically their economy and their healthcare systems, leading to a shift from primarily communicable diseases within the country to non-communicable diseases. Non-communicable diseases referring to any disease not caused by an infectious agent, and we're going to talk about why we care about this in the global health context, but some things to keep in mind is that as a country becomes more motorized and urbanized, we're going to see more sedentary lifestyles develop. This is going to present a great global health burden when it comes to things such as cancer prevalence, stroke prevalence, and cardiovascular diseases.
Here, we're going to talk about the global health burden of non-communicable diseases. Non-communicable diseases kill about 42 million people each year, which is equivalent to 74% of all deaths globally. The top 4 non-communicable diseases that account for over 80% of all non-communicable disease-related deaths include cardiovascular disease at 17.9 million deaths, cancer at 9.3 million deaths, chronic respiratory disease at 4.1 million, and then diabetes at 2 million deaths. With these numbers rising like they are, professionals are worried about the 2030 Agenda for Sustainable Development, which's whole goal is to reduce these numbers by a third in 2030. These rising rates are also predicted to impede poverty reduction initiatives in low-income countries, so overall, non-communicable diseases are doing a good chunk of damage.
To reduce the occurrences of non-communicable diseases, it takes a combination of individual, community, and policy-level interventions. We can promote healthy lifestyles such as discouraging tobacco use and a balanced diet. We can encourage screening and early detection by raising awareness of NCDs. We can increase public health campaigning by overall focusing on health education. We can advance workplace wellness by encouraging employers to implement wellness programs. We can introduce policy interventions by considering taxes on unhealthy products such as tobacco and ensuring access to healthy food options. And we can strengthen the primary healthcare as a whole to ensure that healthcare systems are able to be equipped properly with the preventative care that they need, early detections, and help manage these NCDs overall.
Overall, in public health, we have 3 different types of prevention approaches: primary, secondary, and tertiary. Throughout this class and within the book, we talked about these types of preventions, and this slide just goes over the general gist of them. Primary preventions include actions that intervene before health occurs, including vaccinations, altering risky behaviors, banning substances associated with the disease, including tobacco, nicotine, etc. Secondary preventions include actions that allow us to screen and identify diseases in their early stages. So, before the onset of symptoms, including mammograms for those at risk of breast cancer, blood pressure testing for those at risk of high blood pressure, and lastly, tertiary prevention, which includes managing diseases after diagnosis to stop the progression, including chemotherapy, rehabilitation, and screening for other further complications.
Now that we've introduced the idea of prevention approaches, let's look at a specific example for a non-communicable disease, specifically coronary heart disease. So for primary prevention, we want to prevent the disease from ever even occurring. So we can do that by being active, having a well-rounded diet, and avoiding tobacco. For secondary prevention, it's all about screening, detecting the disease early before symptoms develop. So we can do this by getting an ECG done, cardiac CT scan, or checking our blood pressure regularly. And then for tertiary prevention, it's all about how the disease is currently present, but we want to prevent it from getting worse. So we do that through medical interventions, such as taking beta blockers, changing our diet to a more Mediterranean-based diet, or becoming more active and putting a stent in a blocked artery through surgical intervention.
So overall, it's evident that there's a growing prevalence of non-communicable diseases on a global scale, and there's been more of a focus on these diseases in the last decade in an effort to reduce the burden of disease. All countries, whether they're developed or not, should ensure that there are active efforts in place to reduce the burden of disease. And some of these efforts include access to education, allotting more funds and research toward preventative treatment, and policy development to counteract those risk factors. Because a focus on risk factors and preventative measures are a key component to address the NCDs. And countries need to understand that they need to take a cost-effective and speed action approach to ensure the most effective implementation methods. And also, if you look to the right, there's another figure that shows the prevalence and classification of NCDs predicted by 2030. So we hope you got a lot out of our presentation and learned something new about non-communicable diseases. Thanks, and Gig'em.